In Ghana, facing a history of diseases like monkeypox, COVID-19 and cholera, the proposal for a public health emergency fund is gaining momentum as a promise to safeguard all citizens. Aminatu Nelson, a senior nursing officer, backs the idea from her first-hand experience with patients who always face financial challenges. In this report, join me, let's delve into strategies for redirecting COVID-19 levy funds towards establishing a public health emergency fund. There's more.
Dennis Dari, a surgeon at the Greater Accra Regional Hospital, has contracted COVID-19 twice, a consequence of the nature of his profession.
The journey with COVID has been stressful. For our work, I mean, there are situations you have to avoid contact with patients. Normally, we like to get in contact with our patients, examine them physically. So it's been quite terrible on that part. We've lost people because of that.
Having faced challenges with patients unable to afford treatments, Dennis Dari suggests utilizing the COVID-19 levy to establish a public health emergency fund. This fund could play a crucial role in building a resilient healthcare system.
I think it's a laudable idea. Considering, I mean, we've got other problems that patients face. There are a lot of diseases around, communicable and non-communicable diseases that we need to deal with beside COVID. So if we channel that into all the other conditions, I think it will be a good thing. TB, for instance, HIV is on the rise, and we also have malaria is not gone, and other conditions that we experience. And then we could also just keep something aside for outbreaks.
Ghana, a nation with a history of grappling with infectious diseases and outbreaks like monkeypox, cholera, chickenpox, meningitis, Lassa fever, measles, yellow fever, Marburg virus disease and COVID-19 pandemic, is at a pivotal juncture in its fight for public health. The idea of creating a public health emergency fund is like a guiding light, a promise to keep all Ghanaians safe from unexpected health problems. Aminatu Nelson, a senior nursing officer at REG, concurs with the idea, drawing from her close interactions with patients and their financial struggles in accessing healthcare.
It's best we use it to cater for other issues that need to be attended to. So if we don't use the money and the money is there, and people are perishing due to other outbreaks, it wouldn't be fair.
Despite Ghana's participation in international agreements, the Public Health Act of 2012, Act 851, which proposed a dedicated funding stream for health emergencies, the nation has often relied on international donor funding. The onset of COVID-19 pandemic led to a groundbreaking response with the introduction of the COVID-19 Health Recovery Levy in 2021, showcasing Ghana's resilience and ability to manage the crisis. However, with a shift in the World Health Organization's declaration regarding COVID-19, questions arise about the fate of the levy and the related fund. Health experts like Dennis and Aminatu are among the many advocating for the transformation of the COVID-19 levy into a paramount public health emergency fund, a crucial step towards building a strong healthcare system. Franklin Esiedu Bequin is Director of Public Health at the Ghana Health Service.
The COVID-19 levy apparently had a specific purpose, but we are advocating if it could be used for public health emergencies in future. We are in an era of unusual events that could lead to outbreaks. So there are two ways to handle the issues. It's about making sure that we have secured or earmarked or ring-fenced source of funding for public health emergencies. And then we also make sure that our health system is very sensitive so that we are not overwhelmed to get very large outbreaks that can make things worse for us.
As Ghana stands at the crossroads, the story aims to ignite a nationwide conversation, urging everyone to rally together for the establishment of the Public Health Emergency Fund.
On May 5, 2023, the World Health Organization declared that COVID-19 was no longer a public health emergency for international concern. This shift implies that although it remains a public health threat, countries can now transition from emergency mode to managing it akin to any other infectious disease. Godwin Asif, TV3. Why is this topic really important at this moment? Emmanuel Afia is the Deputy Country Director for civil society organization Send Ghana, and he is joining me on phone to let us understand better why it is important. Sir, thank you for your time. Send Ghana wants the government to retain and rename the COVID-19 levy for it to serve as a funding source for the Public Health Emergency Fund. How far with conversations so far on this?
Thank you very much, Godwin, and good afternoon to your televiewers. viewers.
Go ahead.
Yes, indeed, Send as a civil society organization that has been working actively in the health space, think that it is important for government not to stop the COVID-19 health levy as some people have been advocating for, but rather we think that it's important rather to convert that into a public health emergency levy and use that to fund what is called public health emergency fund. Yes, your question is asked just because of the fact that, the medium-term development framework for health, 2022-2025, actually states clearly that government needs to establish a public health emergency fund. But then the fact is that if the fund is established, where do you get money to actually use it for the fund to be operational? You agree with me that we cannot always be depending on donor funding. And indeed, we do a lot of budget analysis and analysis over the years. Any trend analysis we do shows that donor funding, of course, generally and on particularly the health sector, has been dwindling. When COVID hit, as a country, we have to depend on the stabilization fund to actually cater for the initial challenges that we face. And then we went out to borrow to get funding to cater for that. And so for us, it was commendable that government initiatively came out with the COVID-19 health levy to solve that problem. And fast forward, now COVID-19 seemingly is not really a big challenge again. And so we might want to think that, and so I want to side with people who are calling for it scrapping. But what we are saying, we've realized that if you look at budget analysis from 2021, when the fund was established, that year we got around 89 million Ghana cedis. A year down the line, 2021, we got around 1.1 billion. Then 2022, we got 1.5. Last year, the country opened about 2.5 billion cedis. And this year, 2024, we are projecting up around 8.1 billion, which will be about 1.8, it will contribute about 1.8% to the total revenue for our country this year. This is a good amount of money that, brother, that we can use to help in our public health emergency. I was listening to what you played before, and you were right on point mentioning Lagos and all the other public health emergencies that our country faces. Tomorrow, on just about an hour's time from now, we may come to terms with another public health emergency. The government is currently coming out with a policy called the health security policy. Beyond the policy, we need funding for it. And so it is important that we look at what the National Development Framework is calling about, the Public Health Emergency Fund. We need money to get that established.
All right, Emmanuel, briefly, why has it taken time for the government to heed to your call?
Of course, you know the basic challenges currently with the economy. And you also know the fact that the public health, the COVID-19 health levy was established just for a specific purpose.
Right.
And so it takes time. You need legislative processes before you can actually change it. which means that we even need parliamentary approval for the change to be done. And so, I remember when we met the Minister for Finance right before the budget, 2024 budget was read. We put forward arguments, and then the thinking was that most Ghanaians are even calling for us to scrap it. So in fact, the ministry was in the face as to what is to be done. And we had to argue our case out that it's important we look at it differently. And so that is why, for me, I think this is very important for all Ghanaians to know, to educate us that taking up the COVID-19 health levy means that tomorrow, if there's any emergency again, government needs to either go and take money from the contingency fund again, or we need to go out to borrow. And we all know the adverse impact of going out to borrow, and that is where we find ourselves in now. So we think that is important. Our call is that government should dedicate it solely for the purpose of public health emergency or public health security. As it is now, the COVID-19 health levy goes into the consolidated fund. So in fact, it is difficult even to track what exactly is being used for. And so in as much as we are telling government that yes, establish the public health emergency fund and use the COVID-19 health levy to actually fund that, but change the name to public health emergency or public health security fund. We are also telling government that let it be dedicated solely for that purpose. Right. And I believe that if Ghanaians really have the confidence from government that it's going to be dedicated solely for that, I'm sure that everybody is going to rally around. So I'm just telling those who are listening to me or watching me now that let us all support. AGI and the Gutta, I know, have been speaking about the fact that it's important for government to scrap it. But I'm telling the president of Gutta and all those calling for scrapping of the COVID-19 health levies that if we do that, tomorrow, if there's any public health emergency, all of us are going to be affected. Let us rather police the fund and make sure that government dedicated solely for public health emergency or public health security. Thank you.
That's well noted. Yeah. Emmanuel Ayifa is the Deputy Country Director for Civil Society Organization Send Ghana. And we also understand that within the first 8 months of its implementation, data released by the Ministry of Finance showed that an amount of 773.93 Ghana cedis had been released for the COVID-19 levy. Fast forward, it had increased to 889 million Ghana cedis by the end of 2021 and further to 1.14 billion Ghana cedis in 2022, with the government anticipating to collect some more, which is about 2.5 billion Ghana cedis from the levy in 2023. So definitely, this is a good call from Send Ghana. You're still watching Weekend Central here on TV3. My name is Godwin Asidiba. We are back shortly with more stories. You need to stay with us.